Do you get popping or does your back feel tight after you do any sort of hip flexor work, whether that's dead bugs, pulling with your hip flexors, or standing band exercises? Well, I've got 3 tips for you that I want you to try that I think will really help. Tip number 1, I want you to connect your rib cage to your pelvis. So as you go to lift your leg to work your hip flexor, I want you to think about connecting that opposite rib. So you're almost going to bring that rib kind of down and across a little bit, thinking about connecting it to that opposite pelvis. All right, what this is going to do is recruit your obliques a lot more. And in turn, that's going to help stabilize your pelvis a lot more. And if your obliques are working for stability, then that means your QL doesn't have to work as hard. Those paraspinals don't have to work as hard. We've got more obliques kicking in to help us stabilize through our trunk. So give it a try. Think about bringing that opposite rib down and connecting it. You're not gripping down with your upper abs. You're thinking more about a little bit of cross-body action going on. And I think that'll feel pretty good. Tip number 2, I want you to think about your pelvis positioning. So as you go to work your hip flexor, I want you to think about what position your pelvis is in. And I want you to aim for a little bit of a posterior pelvic tilt. So as you go to lift your leg, I want you to think about tucking or swooping under just a little bit. So you're not crouching down when you do it. You're going to stay tall, but I want you to think about coming under as you lift. What that's going to do is allow you to recruit more psoas and a little bit less TFL, because that TFL pulls you into an anterior tilt. That causes more hip impingement, fraying on the labrum, things like that. So I want you to think a little bit of a posterior tilt, just kind of like a little swoop coming through, reaching, thinking about making your knee, your femur long as you go to lift, instead of letting your pelvis spill forward as you lift, increasing impingement and TFL recruitment. And tip number 3, I want you to think about your pelvis height. So as you do, even on the ground, doing dead bugs, as you lift that leg, if you're doing it where you have some hip flexor resistance, I want you to think about what's happening with your hip and don't allow hiking. Okay, so if you hike your hip as you do hip flexor work, you're probably going to be recruiting a lot of that QL to do the hiking. So what I want you to think about is keeping your hips level. You can even almost think about keeping this hip a little bit lower if that is helpful as you do hip flexor work, and to make sure that you are not hiking up your hip as you lift your knee. So you are swooping, you are connecting, and you are staying grounded, and then you're going to feel amazing doing hip flexor work, because your hip flexors really need to be strong. It's not the first place I go when I do a workout program or any type of rehab. I usually don't start with hip flexors, but it's definitely in there in the middle or toward the end, because they are a very important component of the pelvis and keeping the hips and pelvis really healthy. And especially for low back pain, if you're having any low back pain from sitting, you might need to work your hip flexors. All right, so give that a try and see if those 3 tips don't help with you feeling better about your hip flexor recruitment and everything else that's recruiting along with it.